This has been a great discussion. Thank you all for participating. We've reviewed and discussed a lot of information on the treatment, monitoring, and now consideration of discontinuation of therapy in folks with chronic myeloid leukemia. To close, I'd like to get any final thoughts from each of the panelists. Neil, if you'd like to start.
Just following up on what we just discussed, monitor patients, not only if they're going to be going on a discontinuation study, but if they're continuing therapy, and encourage them to continue to participate in clinical trials, because we've made enormous strides over the previous years, and we can stand to further move the needle in this disease.
I'm going to steal one of Neil's comments, right? That CML has become a disease that seems very manageable. We can really manage it well, and docs out there have the opportunity to really manage it well. You have to be careful that we don't mismanage it as well. And so I think that there are some important guidelines that will help generally practitioners manage this disease better. I think monitoring is really, really critical. I think efforts to deal with compliance issues are very, very important. And I think ultimately there are times where you just need to refer someone to a physician, a team of physicians that see lots of CML when you're in a situation where clinically the patient's not responding as well as you'd like.
Absolutely.
You know, great therapy. We live in a modern era where we have so many options. This is great. We all agree that monitoring is very important. Early responses are crucial. Be careful with the PCR interpretation. Don't take one value, track them, get a sense of the dynamic of the disease. Don't stop therapy outside clinical trials. Don't do it in your backyard. And plenty of new promising agents.
And if you think about it, the last 15 years we went from bone marrow transplants being the only thing we could offer these patients to a pill that, for the most part, will give them normal survival. So it's been a remarkable ride in a very short amount of time. We're sitting here arguing about the nuances of molecular monitoring and the nuances of bad, mutations. But the majority of patients who walk in the door in the standard doctor's office are going to do well with whatever you pick if you follow them properly and you monitor them properly. And if you're not familiar with the disease, you still can be the doctor, but pick up the phone and call a friend. I mean, this is one of those diseases I love to get phone calls from doctors in the area saying, hey, can you just look at a PCR? What does this mean? And it's a simple little call just to make sure you're doing the right thing for your patient. It's not that hard a disease to manage, but you can mismanage it. And if you do it right, most patients are going to do well.
Wonderful. Thank you all very much. Thank you all for joining us.